The reasons for complications after a total knee arthroplasty are often the same. Beside the wear of polyethylene particles, the release of metal ions from the implant has become an important research topic. In the following graph, you can clearly see a correlation between metal sensitivity and a poor outcome of a total joint arthroplasty. In the general population, approximately 10% of the persons suffer of metal sensitivity. Patients with well-functioning total joint arthroplasty show approximately 25% metal sensitivity, whereas 60% of patients with poorly functioning total joints have metal sensitivity. This means that the rate of metal sensitivity dramatically increases to 60% in patients with poorly functioning implant if the patient shows implant-related allergic reactions like skin changes, eczema, delayed wound or bone healing, recurrent effusion, or implant loosening. Due to that reason, the detection of metal allergies is becoming more and more important, especially in revision cases. In vitro studies show that corrosion products from cobalt chromium implants seem to shift the balance towards bone resorption and to aggravate the inflammatory response in bone cells. In a study of Reich et al., the ion concentration of standard cobalt chromium implants as well as AES-coated implants has been investigated after a knee wear simulation. The result can be seen in the graph. The release of cobalt and chromium is quite high compared to the release of the metals from an implant with advanced surface coating. With the AES multilayer coating, metal ion concentration is near the level of detection and below biological threshold. This means that the higher risk of a hypersensitive reaction could be reduced by using a multilayer advanced surface coating. We developed additional test methods that exceed the common ISO test procedure. The so-called HDA testing shows the cobalt ion release during knee wear simulation for 5 million cycles with standard cobalt chromium and AES-coated implants. 5 million cycles represent a realistic implant life of 15 to 30 years. Even though the cobalt ion release of the standard cobalt chromium implant decreases over time, the ion release is significantly higher than the one of the AES multilayer coated implant, which is below the detection level. Study results show that the multilayer coating is more effective in the reduction of metal ion release than the monolayer coatings. This graph shows the metal ion release of implants with AES coating in comparison with monolayer coatings. The metal ion release could be reduced to 2% for cobalt and chrome and 10% for molybdenum with the advanced surface technology. The study of Leo Whiteside documented 28 patients with clinically severe metal allergy, severe pain, swelling, and effusion after primary total knee arthroplasty. 17 of these patients received an hypoallergenic revision implant. 7 thereof were implants coated with our advanced surface technology. 4 received a standard cobalt chromium implant, and 7 remained untreated. The 7 unrevised patients and 4 revised with standard cobalt chromium implant did not improve or even worsen over time. Symptoms resolved in the 17 patients revised with hypoallergenic components. The Knee Society score could be improved significantly. A result of the very low metal ion release in implants with advanced surface coating is that the products do not need to be labeled with CMR. CMR marked means that an implant contains carcinogenic, mutagenic, or reprotoxic substance. This special labeling is a requirement of the new medical device regulation, and it shows the importance of metal ion release in total joint arthroplasty.